Also, in talking about science-based findings, there are a couple of really important principles I want to make sure you're aware of, because perhaps you are going to be in the position one day of doing exactly what we do here at CDC, which is trying to communicate to people sometimes things that are very difficult or complex or keep changing over time. Some of the best advice that I can give is that you state it very simply and be very specific and direct about what you did, how you that is how you figured out what's going on and what you found, what it meant. And perhaps most importantly, people remember things when they can integrate it into their life. So always ask yourself, what can I tell people about what they can do based on what I found? What is the advice I want them to follow? Because in the end, that's public health. We come up with a recommendation that we hope is going to change people's behavior for the betterment of themselves and for the betterment of everyone else. It's also important to be very directive, not be wishy washy, but at the same time, be honest about limitations. So you want to state clearly and directly what your advice is, but you don't want to couch it in so many qualifications that you end up throwing out the baby with the bathwater. Some of us are very precise people, and we feel very strongly that we have a firm conclusion, but we may feel over obligated to get into the details about all of the limitations. And remember, people will ask you about those limitations or challenge you if they have them. So, as a good example with regard to masking, we might say something like, a large body of evidence now supports the benefit of masking, and with little evidence of any risk to health. How is it that we can make statements like that recommendation? Um, in another, let me put it another way. How do we come in it from just one experiment to many experiments to know that this is something that we want to make as a recommendation? What I'm trying to get at is establishing the possibility of causation. All right. For instance, cigarette smoking. I think people early on, as far back as the 1930s and 40s of the last century, recognized that cigarette smoking was a harm to health. And some of the early studies suggested that people who smoked also got lung cancer. But one study wasn't enough. And people, there's a big cigarette industry. They were very committed to selling their product, and they really wanted. And Americans enjoyed smoking immensely, so they really wanted to be confident that this was a real finding. Well, what builds my confidence so that I can make a broad statement like the one I just made about masking? A couple of things. First, multiple studies. So the more evidence that you have, the more studies that you can do, the better, because that gives you more evidence. If you study many different kinds of populations, that means you can broaden the finding to more and more people. Maybe I just studied, educated white men in one group. I studied low educated and Hispanic persons in another population. I come to the same conclusion. I can be confident that that finding is generalizable to people of different backgrounds. Also, you use different methods and approaches. So this is more of a technical issue, but the kinds of scientific studies that we do vary. There are cohort studies, case control studies, randomized control studies. You may have heard these in the news or know them well yourself, but the more that you can use different types of studies to look at the same question, again, this really strengthens whatever conclusion you come to. And then finally, that you address the question in different times and places. So I might look at it during the summer in one part of the country, in the winter in a different part of the country. And in the case of cigarette smoking, it became evident over a number of years that no matter how you looked at the question, you kept coming to the same conclusion. Similarly, masking had a same finding that no matter how we tried to look at the question and analyze it, we kept coming to the same conclusion that places that had put masking into place or people that used masks had a lower risk of disease. This is sort of the phenomenon of what I call all of the road signs pointing in the same direction. It's very hard to prove with causation, right, that smoking causes cancer. That didn't come until the 1960s and 70s when we had laboratory research and we really understood the mechanism by which it happened. But the epidemiologic data that we had, what I've just described, was immensely overwhelming, that it caused cancer and actually led to public health recommendations just as some of this fundamental understanding around what was actually going on became known. Similarly with masking, we had this important information available through lots of different ways and felt confident that all the road signs were pointing in the same direction. Lastly, I just want to point out that context is important here. Sometimes there'll be a new way of looking something, and we may talk about this in a moment. I'm going to, as an example, use wastewater surveillance. There may be a new way of talking about something that comes along, and when the numbers appear on your computer screen or the figures are there, that looks pretty definitive. I mean, it's black and white on your screen. This is the value that we're seeing. And as depending on where you are, it's important that people understand the context of what you're seeing, to better interpret what those data mean. It may be black and white on your screen, but everything has a little bit of nuance. And then lastly, I really want to emphasize the concept of health equity. Um, you know, we in the public health service and who serve the public serve the entire country. And if we don't take care to ensure that the findings that we are generating and the recommendations that we are making apply to everyone, then we're really not serving anyone. And so be assured that all the work we do uh, makes takes great care to ensure that when we make a recommendation, we can apply it with fidelity to everyone in this country.